Welcome to this chapter on anatomical terminology. The anatomical position is basically a reference position. It is a particular body orientation used when describing an individual's anatomy. The body is considered standing upright, facing forwards, with the legs parallel to one another, slightly apart from one another, knee and the hip extended, toes pointing forwards. These are all the features of the standing position or the anatomical position. Additionally, the eyes are open, looking horizontally forwards, mouth is closed, upper limbs or arms hang at either sides, the palms are facing forwards. Forearm is in supine position and the palms are at a distance from the hip so that the carrying angle is utilized at its best. The penis is erect and located in the mid-sagittal plane with the dorsal surface of the penis touching the anterior abdominal wall. That means the ventral surface is facing forwards. Now, let's look at some of the descriptive anatomical terms. We can divide the human body in terms of descriptive terminology into three planes. Horizontal plane, as you can see in this photograph, that's the plane through which horizontal references or locations can be described. And if you make a cut, let us say in the region of the head, you will see a cross section like this. Similarly, next, coronal plane. It is perpendicular to the horizontal plane, and that's a rough direction of the plane. And when you take a cross section, either actual or through an MRI, CT, etc., you will see a cross section like this. Now that's the coronal plane, and that's the cross section. Next is the sagittal plane. It's a plane that runs anteroposteriorly. The reference here is the mid-sagittal plane. Similarly, there can be parallel planes on either sides, and a cross section exactly here in the region of the head will give you a cross-sectional view like this. We'll proceed further with the other terminology, like terminologies relating to a surface or a particular position, etc. Details will go. Like for example, the two arrow marks contrasting with each other, the anterior and posterior references, roughly suggest anterior surface, posterior surface, anterior relation, posterior relation, or the words ventral, dorsal can also be used. Likewise, we can have lateral and medial relations. That means medial is towards the midline of the body or towards the mid-sagittal plane. Lateral is away from the mid-sagittal plane. Next, superior and inferior are two other comparative terminologies. With reference to a rough midpoint, you can have a dimension above it or a dimension below it, superior and inferior relation or surface. Likewise, with reference to a point, you can have an element proximal to it or a part of anatomy distal to it in a relative basis. Similarly, a structure may be superficial or it may be deep. For example, skin is superficial. Most of the organs are deep. So it's a relative way of expressing the anatomy. Similarly, you can have external and internal as two contrasting reference terms in routine anatomical description. Likewise, in certain areas, we have very specific terminologies like the radial border and the ulnar border, or the radius and ulna. This we use usually in the forearm. Similarly, in the lower limb, in the region of the leg, we use tibial border and the fibular border corresponding to these bones. Next, we can also have a palmar surface and a dorsal surface in the region of the hand. Similarly, we can have a dorsal and a plantar surface in the region of the foot. Next, we use the word ventral view and dorsal view. as a standard descriptive terminologies. You can also use the word anterior and posterior. Sometimes for descriptive comparison or references or contrasting, the terms unilateral and bilateral may be used. That means with reference to a mid-plane, there can be a reference on one side or it can be a reference on both sides, or you can even have ipsilateral with reference to a single point. The other comparison can be on the same side as the point, or it can be on the opposite side, in which case we call it as contralateral. We use this when tracts are being described in neuroanatomy. Similarly, when we look at movements, a few movements we will describe. These are all examples just to substantiate how we use the terminology. This may not be complete or exhaustive, but they are only exemplifying the way these anatomical terms are used. Likewise, in the region of the elbow joint, you can have flexion, whereas where the forearm is raised towards the arm, or you can have extension in the opposite direction. Similarly, in the region of the shoulder, you can have abduction and adduction. That is, the shoulder joint in abduction, the whole limb is raised away from the body, and in adduction, it is brought back towards the body. You can even have medial rotation and lateral rotation as referenced in this particular photograph by those curved arrows. Similarly, we can have in certain specific areas, there may be certain terminologies specific to those areas. Like, for example, the hand may have dorsal flexion and palmar flexion, with the wrist being the joint of reference. Similarly, in the lower limb, ankle will be the joint reference. There can be dorsiflexion and plantar flexion at the ankle. So that was a short tour of the anatomical terminology. Thanks.